And there is evidence that the country is facing a crisis with nationals who are overwhelmed by life struggles. With an increase in the incidence of suicide, the director of Turning Point says it is a telling sign of what is happening with respect to the psychosocial existence of the people.
We've been aware for a little while that depression has been on the rise. We've seen that in the increase in the number of suicides. As you said, there are a lot of new persons with mental conditions on the street, various mental conditions. Some of them are not confirmed, some of them may be new cases, we do not know. Unless we do a survey, we would not know exactly what's going on with them. But just from observation, you can see that it's on the rise. We have been aware of the crisis. It seems as if there is a spate of suicides where several persons have already taken their lives. What we do know is that suicide comes usually at the end of depression. It may be the last phase of depression. There are other conditions, there are physical conditions also that may be related to that. Sometimes people go through very, very stressful situations, and we know that the financial situation is one of the main things that people are complaining of. People are experiencing a lot of financial hardship. That is also having effects on their ability to sleep. It's raising stress levels, and people are falling between the cracks.
Joanna Joseph is encouraging the public, especially those who feel depressed and overwhelmed, to call the health helpline.
We had at least 4, maybe more, orange alerts, meaning persons who were very, very serious about committing suicide, very desperate persons, and they were able to get help. But the health helpline is only part of the response. We need people to be aware that when we have mental conditions, we need to get help. We need to run and take it as seriously as we run to the hospital when we get hurt. We need to run to get help. Sometimes we prevent those persons who need help from getting help. We let the stigma and all these negative things that we believe get in the way of us as family members taking our loved ones to get help.
Critical to saving lives as well is the intervention of family and friends.
The individual may not necessarily say anything, but you would notice certain changes. Persons who are eating a lot or not eating. There may be a decrease in interest. They've lost interest in things they used to be interested in. Not sleeping or oversleeping, spending all day and all night just sleeping. That's a sign of depression. We need to be aware of these things. Persons may reach a point where they are so hopeless, they've already given up and we don't even know. But when we see those signs, we need to take those things seriously, and especially when people indicate that they feel hopeless and that all they see in life is just to end it. We need to take those things seriously. We must stop laughing at the men when they talk about Gope well and they talk about their heartaches. We need to make it safe for males, our males, to say how they feel, and for persons not to ridicule them or for them to be afraid of saying how they feel. Because what we know is that men tend to be the ones who are successful in ending their lives, in committing suicide.
Meanwhile, Stlucia will join the global community in observing September 10 as World Suicide Prevention Day.
This day is endorsed by the International Suicide Prevention Association and the World Health Organization. The theme for this year's activity is preventing suicide, reaching out, saving lives. The Ministry of Health has found it necessary to have some activities during the month of September in an effort to raise awareness of suicide prevention and the services which we offer for persons who are contemplating suicide. Recently, we have introduced the helpline. You call 203 from any phone, a line, Digicel, any landline. It's a toll-free number. You're not being charged for the call, where we have some social workers who will listen to your problem, and based on whatever your issues are, we'll address it accordingly. We have made an alliance with the different institutions, and depending on the severity of the issue, the social workers will address it.
Several activities have been planned with the opening event, a church service scheduled for Sunday, September 6th at the Ulster Pentecostal Church.
We have the staff and the patients of the Wellness Center, as well as guests from the Ministry of Health that will be attending the service to help open the event. Our second activity is on the 7th of September. This is our fair and exhibition. This is where the patients who attend occupational therapy will exhibit their pieces of art. In addition to that, we have an arts and craft competition. This is where the patients and staff came together, put together a piece of art that will also be exhibited on that day, and we will be given an award will be given to the best piece of art. Another activity is the Arts of Wellness. This will be held on the 11th of September. This is where the patients and staff come together to showcase their skills, their talent in the form of songs, dance, and drama. And this is promising to be a spectacular event. We had it last year, and it was a great success. So we're hoping this year it was going to be a greater event.